2023 SEOW meeting. My name is Shayna. For those of you who don't know me, I'm a co-chair for the SEOW. My other co-chair, Tiasha, is lucky enough to be overseas and missing this gray, rainy weather that we've been having in Denver. So it will be just me facilitating today. We'll go ahead and jump right into our introduction breakout rooms. Junior, if you don't mind helping me get those going, we'll just be breaking out into groups of about 4 to 5 people for about 5 minutes for just some quick introductions, a little bit of networking. And then as the topic of today's meetings are the 2023 SEOW epidemiological profiles, if you want to share within your breakout room how you're hoping to use these profiles, whether it be the data informing the work that you do, sharing them out to communities that you're connected with, whatever it may be, if you could just share with your breakout room fellow attendees what you are hoping to get out of this and these profiles, that would be great. So Junior, if you want to send us away as soon as you're ready. It looks like everybody is getting kicked back out into this main room to join us. So again, for those who I maybe didn't get a chance to welcome at the very top, welcome to today's meeting on the highlights of the 2023 Epi profiles. And I'm actually going to turn it over now to Peter Rumbach so that he can do a brief introduction of the newest member of the team at the Evaluation Center working on the SEOW, Lauren Gant, for those who weren't in our breakout room.
Yeah, thanks, Shayna. Yeah, we want to welcome Lauren, who started with our team about a month ago and will be taking over as the lead for the SEOW on behalf of the Evaluation Center. And so she'll be presenting today on the Epi profile and actually along with myself rather than Jeff. So just an update on that. But we're excited to have Lauren join the team and excited to see her lead the SEOW into the next phase. So welcome, Lauren.
Thank you so much, Peter, and thank you, everyone. I'm really happy to be here and happy to be working on this project.
Great, thanks, Peter, and thanks, Lauren. And now I will actually stop sharing and hand it over to the pair of you to walk us through some of the highlights from the Epi profiles.
Okay, can everyone see my screen? Perfect. All right, so good morning, everyone. My name is Lauren Gant again. I'm a senior evaluation specialist for the Evaluation Center housed at the University of Colorado, Denver. And again, Peter has been working on this project for, I believe, 8 or 9 years, so he will be presenting with me as well. He's a great resource to give some context and how these projects were developed, and so he's a great resource to have. So thank you, Peter. So today we'll be discussing the 2023 Colorado Epidemiological profiles. So our team has been working with CDPHE in the spring of 2023 to create a series of epidemiological profiles that were developed with the intention of providing readily available data findings that are usable and digestible resources that are meant to be disseminated widely. So as we are presenting these, I hope in the back of your minds, you're thinking about who would be a great audience to share this with. Are there online platforms that might be great for us to share these to? Thinking about, are there presentations that we could share these with? They're great as handouts. And so I'll be sharing more about that as we go along. Okay, great. So today we'll just be providing an overview of the profile content, things that you'll expect to see, and I'll talk a little bit about how they're developed. What does that process look like? It's a collaborative effort. And I'll be sharing some profile highlights. They're not meant to be the key findings from each profile, just to give you a taste of what you expect to see. Again, get you thinking about who might benefit from, seeing these resources. And I'll provide some suggestions on how you might use them to support substance use prevention, harm reduction, treatment, and recovery efforts. Again, the purpose of these profiles is to be a practical reference for all Coloradans who are interested in talking with their communities about substance use and related harms. This includes everybody from youth groups to community organizations to school superintendents to state legislators. There are a series of profiles that can be used as standalone publications if you're just interested in just a few topics, but they can also be used in conjunction with each other. Again, they're visually appealing, so they're great for handouts or presentations. And the publications have not been published yet, but they will be available on the Colorado SEOW website. And they also will be released in waves. So just check back in on the Colorado SEOW website. There's a first round that will be sent out, and then there's a second round, which I'll dive into more. And yeah, and so next slide, Peter. You can go 2 more. Yeah, so the content for these profiles, so SEOW releases these profiles every other year. So I'm going to be sharing some updates since they were released in 2021 and what you expect to see in 2023. So in 2021, we had profiles on alcohol, cannabis, tobacco, and opioids. And in 2023, we updated these and then also added an additional profile on stimulants. And then for the next slide, we also pulled information on mental health and populations with special considerations from the 2021 demographics profile. We just thought that these topics needed some extra attention and decided to turn them into their own standalone profiles, which we'll be talking about more. We also added an additional behavioral health in the COVID-19 profile that will be released in 2023. So how are these? Next slide, Peter. So just to give you a little bit of context on how these profiles are developed, over 40 sources are used to create these profiles, including data from surveys, peer-reviewed journal articles, technical reports. So here are just a few of some of the resources that we have used. It's a collaborative effort between the evaluators at the Evaluation Center, subject matter experts, so that we make sure that we are putting these statistics that we show within a broader context. We just want to make sure that when we are presenting data, we do it responsibly and we make sure that we provide historical, social context to these trends to, again, make them more useful when we're being responsible. So that is the intention. And so all those are reviewed by subject matter experts, data experts, to make sure that it is a thorough process. All the profiles contain publicly available information, which is great because if you statistic stands out to you and you want more information on that topic, really want to dive in more, you can easily access that, find the full report, which is great. And as you know, one thing to point out is that lag time with publicly available can vary. So the time span of the most complete data we had for these profiles went up to 2021. So just important to note that. Okay, Peter, next slide. And so we will be sharing some profile highlights, again, just to show you what is to come, what you'll expect to see, what they look like. Again, you'll notice that they're very visual so that anybody and everybody can understand them and use them. So, and Peter, you can take it away.
Cool. Thanks, Lauren. So yeah, as Lauren mentioned, these are highlights from the profiles. They're not intended to be the most important data points or trends. They're just illustrating what type of data sources and data points we use within the profiles. And so to start on alcohol, we know that 1 in 5 Coloradans reported binge drinking in the past 30 days, which is slightly higher than the national average of 15%. We saw that the age group 25 to 34-year-olds had the highest prevalence, followed by 35 to 44-year-olds and 18 to 24-year-olds. Related to deaths due to excessive drinking, over 2,500 Coloradans died between 2015 and 2019. That's combining acute and chronic causes. Acute causes are those with a short duration from time of onset to time of death, so things like alcohol poisoning, motor vehicle traffic crashes, and suicide. Chronic causes include those that are with a longer duration from time of onset to death, so things like alcohol liver disease, alcohol abuse, and chronic pancreatitis. And for chronic causes, those aged 50 to 64 had the highest number of deaths between those years. For cannabis, past 30-day use has increased since retail cannabis became legalized in 2014. However, use has not increased significantly in recent years, so 2019 to 2021. Nationally, use has increased significantly, however, from 2018 to 2020, according to the National Survey on Drug Use and Health. The number of cannabis exposures reported to the Poison Center has steadily risen since 2010, with a large increase occurring in 2014 when retail cannabis became available. And of concern, cannabis exposures among children ages 0 to 5 began increasing in 2012, with the highest number of cases in 2021. And so in 2021, almost half of all exposures were for children ages 0 to 5. In 2021, most Coloradans used cannabis for non-medical reasons, and smoking remained the primary method of use among Coloradans for past 30-day use, followed by eating or drinking cannabis. For opioids, the rate of overdose deaths in Colorado involving opioids increased from 2019 to 2021. This is similar to national trends. Overdose deaths involving fentanyl have increased year over year since 2017. And then we know there was a spike since 2019. The 3 counties with the highest rate of overdose deaths from opioids, that includes prescription or heroin, are Los Alamos, Moffett, and Alamosa counties, with Los Alamos having the highest rate for 100,000 residents. Just over 3% of people in the U.S. age 12 and older misused prescription pain relievers in the past year, and that's lowest among adolescents age 12 to 17 and highest among those 26 and older. Those of you familiar with the National Survey on Drug Use and Health may have heard one of the challenges we experienced in publishing the profiles this year was that SAMHSA, the Substance Abuse and Mental Health Services Administration, released a statement for state level estimates for 2019 and 20, pulling those data from online due to methodological concerns. So we had previously included a lot of those data in the profiles and ended up taking those out. And furthermore, SAMHSA is recommending that we do not compare 2021 national estimates to previous annual data collection. So 2021 and prior, not comparing. So that was a challenge. For stimulants, we saw overdose deaths involving cocaine and methamphetamine rise. So while lower than overdose deaths involving fentanyl, those did increase from 2019 to 2021 for both of these substances. For overdose deaths involving cocaine, they nearly doubled in our state from 2019 to 2021, from 2.3 to 4.6. And then for methamphetamine, it was a similar story. More than doubled from 2019 to 2021, from 6 deaths per 100,000 in 2019 to almost 13 deaths per 100,000 in 2021. Misuse of prescription stimulants in Colorado is similar to that within the U.S., 2.2% compared to 2.1%. The rate of prescription stimulants dispensed to Colorado residents more than doubled from 2020 to 2021. So that's 110 per 1,000 Colorado residents to almost 240 per 1,000 residents in 2021. The map here shows the rate of prescription stimulants dispensed in 2021, and you can see that's highest in regions 3, 16, 17, 20, and 21. All of those are Front Range counties, with the exception of Health Statistics Region 17, which is counties Clear Creek, Gilpin, Park, and Teller. And that range was between 259 to 321 stimulant prescriptions filled per 1,000 residents, Colorado residents in 2021. And now I'll pass it back over to Lauren to talk about the other substances.
Thank you, Peter. 12% of adults in Colorado currently smoke cigarettes. Cigarette use in Colorado is declining, similar to national use, which is about 6% in both instances. 6.8% of Coloradan adults currently use e-cigarettes. Adults aged 18 to 24 use e-cigarettes at higher rates than other age groups. However, since 2019, adults aged 25 to 34 are the only age group to see increased use rates. The next slide. 96.7% of Colorado youth who attend public school currently do not use cigarettes. 16.1% of youth in public school currently do use e-cigarettes. For our populations with special considerations profile, this is one of the profiles that will be released at the second round. Largely because when we are providing context to why certain populations might have disparities in mental health, substance use, it's really important, again, to put that within historical, social context to make sure that we are accurately representing that data and being responsible. So this one is coming later. One of the topics that we touch on is the prevalence, mental health and the prevalence of substance use among the LGBTQIA+ community. So in regards to mental health, only 42% of LGBTQIA+ adults reported good mental health compared to 74.8% of heterosexual cisgender Coloradans. Nationally, 34.2% of LGBTQIA adults reported having a substance use disorder. Among those who had a substance use disorder, 3 in 5 struggled with illicit drugs, 2 in 3 struggle with alcohol use, and 1 in 4 struggle with illicit drugs and alcohol. So when looking at why there might be different coping behaviors within the LGBTQIA+ community, youth and adults experience unique stressors, including stigma, discrimination, and expectations of rejection, which could shape coping behaviors, resulting in disparities in mental health, substance use, and substance use disorders. And when looking, another population that we looked into was veterans. So most veterans experiencing substance use disorders or mental illness have not received treatment in the past year. So 85.1% of veterans nationally with a substance use disorder received no treatment in 2019. 27.4% of veterans nationally with a serious mental illness received no treatment in 2019. And 69.3% of veterans in Colorado who did not receive needed mental health care reported stigma-related reasons as a barrier to services. 1 in 10 veterans have been diagnosed with a substance use disorder, which is slightly higher than the general population. 11% of veterans beginning care with the VA meet the criteria for a substance use disorder. And 67% of veterans reported experiencing pain, making unique issues related to pain management. And the other profile that we'll be adding is the behavioral health during the COVID-19 pandemic. So Colorado youth reported higher levels of mental health decline compared to other age groups. More than half of people aged between 19 and 29 said their mental health declined during the pandemic. And However, substance use declined from 2019 to 2022 among youth. Another important finding, 2020 had the most overdose deaths ever recorded in Colorado history, with a 38% increase from 2019. Drug overdose deaths involving opioids, cocaine, and meth all increased over 50% in 2020. 1 in 10 Coloradans in 2020 were unable to access needed mental health care, which resulted in moderate to severe impact on their health. And 1 in 3 experienced delays and cancellations in mental health appointments. And 1 in 6 experienced delays in getting prescriptions related to mental health. When talking about the substance use decrease among teens in Colorado from 2019 to 2020, I believe a data expert from CDPHE wrote this beautifully that talked about, we can't really fully understand the why behind why substance use trends might be declining, especially the resource that we used for this information came from the Healthy Kids Colorado survey, which is a snapshot year over year rather than a longitudinal study that follows youth over time. But what we do know is that schools were back in person in fall 2021 at the time of the survey administration. We observed decreases in sexual activity, decreases in participation in extracurricular activities and sports teams, and increases in parental monitoring. So that just largely speaks to the long-scale social disruption for young people at the time of pandemic, despite being back in school. So some of the trends that we observed, 29.6% decrease in alcohol use within the past month among youth from 2019 to 2020, 20.6% decrease in cannabis use, 5.7% decrease in cigarette use, 25.9% decrease in vaping. However, 13.2%, there was a 13.2% increase in youth under 13 from 2019 to 2020 who tried electronic vapor for the first time. Again, so that was just a brief overview of what you'll expect to see. And we hope that it gets you thinking about what are ways that you can use these profiles and who might benefit from seeing them. If you go to the next one, Peter. Again, these
just to jump in real quick, Lauren, sorry. This one correction on this slide, it should be 2021, which is the most recent release of Healthy Kids Colorado survey data. So these trends are all 2019 to 2021. Yeah.
Thank you. Again, you can go to the next slide. So these profiles are used in their entirety or great for individual publications. If there's a particular topic that really stands out to you, then you can use those independently. They're great for handouts, presentations. Again, I'd love to hear your feedback about ideas on where we might disseminate these, examples of audiences that we could maybe folks working in community level prevention, state policy makers, and state agencies that work with substance use available data. And we are also available to present this information. If you have a committee or a meeting that you would like us to attend, we can also share these slides. And so, yeah, these are great to share with partners to raise awareness around one or more substance use related issues and inform substance use needs assessments. And again, they will be available on the Colorado SEOW website. They haven't been released yet. They're under review, so we don't even have a tentative date. We hope soon, but so please stay tuned. And yeah, any questions, comments, ideas?
I had a question on one of the slides. You showed a slide with individual drugs and the overdose rates increasing, and it was labeled opioid analgesics. As out of curiosity, does that include fentanyl, which is not really an analgesic?
Yes, I can go back to the original source.
Yeah, I was going to say I might call on Barbara to help answer that classification.
Yeah, that one there. You just passed it.
Oh.
One more
Which one was it on opioids?
Yeah, I think it's the next one or next couple ones.
One.
Okay.
Not that one. It was later on.
It's in the behavioral health and the pandemic slide, Peter. Number 22.
Oh,
There you
this
go.
one? Okay.
Yeah, so looking at the original source, this was taken from the, where did it go? Oh, I just had it pulled up, but that actually opioid anesthesics does include deaths involving fentanyl. And that was from a report on the pandemic. I can send it in the chat because it's not pulling up at the moment, but I do have that.
Okay. I think it'd be interesting to see them split because, you know, fentanyl is obviously a huge driver of a lot of that, and it's different than most analgesics.
Absolutely. I think this is how they categorize it in the report, but I can look into that further.
Great, thank you.
Thank you.
Thanks, Lauren and Peter, for a really great presentation. I have a question to kind of follow up that ties into your last kind of bit about dissemination and ways to share out these profiles, because I know that it's something that we're really thinking about as like an SEOW steering committee, is how do we take these from resources that exist on the internet to actually getting them into the hands of community users who might benefit from them. Are there ways that folks on this call can partner with the Evaluation Center to help share out these profiles once they're available?
Hi, this is Sarah in Broomfield, and one of the things that's coming to my mind is that the state profiles are helpful in benchmarking where we're at, but I'm going to be honest, our community often doesn't really care what the state is doing as long as we're in line with it or better. So it's always helpful if we can contextualize it for our communities themselves. And use these, and I love the visual appeal. I think they're super easy to read. They're great examples for how we can present data and make it understandable and digestible. So I really appreciate that. I'm struggling with like, how would I use it at a local level other than for comparison?
So I can jump in and just say, for next year, there is a plan, Sharon will be talking about this a little more, to create regional profiles. So similar to these, and I think there will also be some discussion about who could help inform those. So I think that's a great question, and something that we're going to consider packaging in a different way at a regional level. So hopefully those would be more useful for health statistics regions and then county level folks in their planning.
And I guess my comment is based mostly on your question phrasing. I find them useful for us to see what trends there are, but if I'm thinking about who I would share them with, it's hard for me to find the right audience unless it has that local level data. But as somebody who wants to know what's happening at the state level, they're very helpful.
That's a great point, Sarah. And I know, as Peter mentioned, Sharon, I think will speak a little bit more to the what's next as far as our ability to deliver more more local results than kind of a statewide look, but I do want to make sure before I turn it over to Sharon, there's a couple questions in the chat. One from Corey asking if any of this data will be broken out by race or ethnicity.
Yeah, so throughout some of the profiles, there is some visuals that share data in that way. We adopted a phrase, no naked data, so not having any data that kind of shows disparities without having some contextualization of it. Historical and social context, as Lauren mentioned. So I think that's the main reason for the population, the special considerations profile. And then also in the demographics profile, there's a little more information around that. So yes, but it's not like a standard on every single indicator to break it out in that way without explanation or context. And then maybe just one other update. I know on the website, we actually different this year from 2021 is we've built out just some of those key highlights you saw today are actually featured on the website as well. So rather than just going to the website and having a PDF you click on, you can actually see 4 to 6 of the highlights from each profile and then get the full download if you want that as well.
So maybe Sharon, I saw you come off or onto video here. So do you maybe want to get to, we can kind of skip a step ahead and have you talk a little bit about what's next for the SEOW?
Yes. So I wanted to let you know we have heard you. And in case you are all meeting me for the first time, I'm Sharon, the Director of the Community Prevention and Early Intervention Unit, which funds and oversees the SEOW project. And so it's funny, I've heard a lot of people say, hey, how long has this been going on now? So wanted to let you know the SEOW first started as a requirement of a block grant, or no, of a grant back in 2014 from SAMHSA. And we no longer have that grant, but we're able to continue the work of this group. And, you know, you're seeing our biggest product, which is the Epi profiles, which takes us about a year to pull all the information together. And so in addition to that, we also, how we operate, we also have, you know, people gather like yourselves to learn about other data sources and giving updates and in-depth look at topics of interest. And we're always continually asking ourselves and you all how we can improve and provide, you know, communities with the data that they need to help plan and improve their services. So when Sarah stated her statement of, you know, how can it be useful at the local communities, that's been something that's been on our mind. So after 9 years of the current structure, so SEOW has been going on for 9 years now of the current structure of the SEOW, we're about to make a change. So starting in the new fiscal year, we're going to be focusing the SEOW efforts on providing regional profiles that align with the CDPHE health statistic regions. And, you know, eventually we would love to get down to the county level, but we're going to take this first step in doing regional profiles first, which will have counties, but just grouped together. So hopefully you'll get data that is more applicable at that local level. And then we're really excited about this change as we'll, you know, be able to provide another layer of data to communities to reference and use. So this is going to be our last SEOW general meeting. And we're going to be grateful. We are grateful to all of you who have been participating in these meetings. But don't worry, we're still going to have our distribution list. We'll still network. We'll send out newsletters. And of course, we'll have the SEOW website to access the data. Just to remind you, our mission is still the same, which we're providing partners, communities, and policymakers with comprehensive data on the patterns, context, and impact of substance use in Colorado to inform interventions at the local, tribal, state, and federal levels. And our purpose is still the same, which is to increase awareness, understanding, and access to data and the data publications that address substance use, misuse, and related health issues in Colorado. So we thank you again for your continued support, and we look forward to this change in providing access to the data. Any thoughts or questions? And then I do see there was a question that came up. Will that be using the health statistic regions? So our regional profiles will be using the health statistic regions. Elise, I see
Hi,
your hand is raised.
everybody. Great to see you. I may have just not heard you, but or misheard you. Did you say this was the last SEOW meeting?
Yes.
Oh, and they're just going away completely, or are they being restructured?
We're restructuring. So we have, you know, as with any projects, we have limited funding. And so in order to be able to do our regional profiles, we have to kind of figure out how we move forward. And so we're going to let go of the meetings and do the regional profiles. But as mentioned, we're still going to have all of you on our distribution list and still inform everyone what's going on, but we're just going to concentrate more of our funding and efforts towards providing, you know, these profiles, because we have a lot of good data in Colorado, and we know we're one of the ones that, you know, take all, you know, instead of having all these people try to go to all these different dashboards, you know, we're the ones who combine all the dashboards or pull all the data from the dashboards and give you an overall picture. And that's what we hope to do for the regional profiles as well. Any other thoughts or questions? All right. Shayna, I'll turn it back to you.
Thanks, Sharon. And I do just want to make a plug here that if you are interested in staying more connected with the SEOW, we are always interested in getting new faces plugged into the steering committee work. So if you are hoping to be more involved than staying on a distribution list and watching what comes out, please feel free to reach out to myself or Sharon or the coordinator at the SEOW email, and we'd be happy to chat about how you can stay more involved as we move forward into this next phase of our work. So to close us out today, I just wanted to open the floor for any member news or announcements about any reports that everybody here has coming out. If there's any conferences that you're aware of, I just wanted to make the space for folks to plug anything that you might have on your radars. All right.
A few other comments, Shayna, in the chat.
Yeah.
Just looked like there was one question, the calendar series for the rest of the year, the calendar year. I think Junior will cancel that moving forward, so that'll come off the calendar. And then Kyle just had a comment that there are some other audiences particular education that would be interested in the regional profiles and audiences there. So I think that's great. If any ideas on expanding the reach of these would be wonderful. And I think, like Shayna said, if you're interested in the steering committee and being involved in that, that's great. Or if you're just interested in sharing ideas, yeah, connect with Shayna or Tiasha or Sharon. That'd be wonderful. Thanks.
Thanks, Peter. And Junior was kind enough to drop that coordinator email into the chat. So if you do have something that you would like plugged in future newsletters, or you remember something the minute you get off, feel free to reach out there. And Sharon, I believe your hand is raised now.
I just wanted to add that also with this change, Barbara Gabella is going to oversee the SEOW moving forward. So you could also connect with Barbara about the SEOW as well. So thank you, Barbara. Yay!
Yes, thank you, Barbara, for stepping into this role. I know I am very excited to work with you moving forward. So if nobody else has any lingering comments or questions, we'll go ahead and bring this meeting to a close. Thank you all for coming today, and we hope that the Epi profiles will be live and accessible very soon. And as soon as they are, you will all get an email letting you know that they're available. So thank you, everybody, for being here today.